Hello and welcome everyone to our fourth session of the 2025 Spring Heifer Academy webinar series. I am very grateful you are here and along with Angel, who will be our speaker for today. And before I introduce him, I'm going to go through a couple of housekeeping things. So as you can see on the screen, Dr. Abuelo will be talking about calf vaccinations and immunity. It is a great topic. I've heard him speak on this before and found it to be very insightful and also very easy to understand in how vaccinations work, how calves build immunity, and what that impact is throughout their lifetime. So, navigating today's session, there may be some poll questions. We don't have anything currently set up, but we would love to have your interaction with the slides. If you have questions, throw them into the Q&A. Angel, would you like to answer them as we go or save them for the end?
Either way, we can probably better if I'm totally fine if we can just do it on the spot, probably would be a
Okay.
good approach.
Perfect. A live recording of the session will be made available on the Heifer Academy YouTube playlist, along with the audio available on our Spotify playlist. At the end of Angel's presentation, if you could please fill out the post-session survey, that'll be really helpful for both of us to see what you gained out of the presentation and also if you have any future topic suggestions. So with that, let me introduce Angel. With us today is my colleague, Dr. Angel Abuelo, the Red Cedar Distinguished Professor with the College of Veterinary Medicine at Michigan State University, whose work is helping us reshape how we understand immune development in young calves. With a background in both clinical veterinary medicine and immunology, Dr. Abuelo brings a unique perspective to calf health, one that bridges the gap between research and real-world application. Angel's research focuses on understanding how a calf's immune system develops in the early stages of life and how strategic vaccination protocols can enhance immunity, reduce disease risk, and improve long-term outcomes. From the importance of colostrum to the timing of key vaccinations, Dr. Abuelo's work helps producers and veterinarians make informed, science-backed decisions. Whether you're a calf raiser, herd manager, veterinarian, or educator, today's session will provide valuable insights into supporting calf health from day one. Please join me in welcoming Dr. Angel Abuelo.
Well, thank you, Cora, for the wonderful introduction and for really having me here today with you. I'm really looking forward to our interactions. And again, this is a topic that I'm very passionate about. Let's see if I can put my screen up. Can see it correctly.
Yep, looks good.
Perfect. So yeah, really excited about being here talking about vaccinating or the use of vaccines for improving calf health. And again, we can use really vaccines for like really either in the calf itself, but also we're going to touch about how we can strategically use vaccines in cows for preventing disease in calves. First, I want to kind of like add two disclaimers. First, I know that the audience for like the Heifer Academy is really international, and I'm to some degree different products are available in different countries. So I want to kind of put like a disclaimer that a lot of what I'm going to be talking about is very US based, understanding that not of all of like the products or types of vaccines, etc., that I might be talking about might be available on every country. So I apologize for that. But then again, happy to entertain questions. I'll probably need to get a good understanding of what's available and what's not, but just looking at this presentation with like the sense that it's very US based because of like the products that we have available and how our farms operate. Second, disclaimer really is a financial disclosure. Again, when talking about like products and particularly vaccines in this case, etc., it's important to really understand any bias that I might bring to the table as a speaker and a researcher. And obviously I have like disclosed that, yes, I have like receiving funding from some manufacturers of these vaccines, etc. So again, useful for you to see through the lenses of how I might be interpreting things. I'm not going to be talking about like necessarily like specific products, but more like types of vaccines, etc. And as you can see from the table, I would really take money from anyone that wants to give it to me for the research. So I think I want to think that I'm not biased, but I always want to clarify that yes, I mean researchers, etc. We do receive funding for like some of these researches, like sponsored by some of the manufacturers of the products that we use. So that can also like influence the result. So our outline for, I mean, I'm hoping that I'll be talking for like 45 to 50 minutes. So we have like some time for questions and Q&As. And as Cora was saying, please feel free to put them on the Q&A. She'll probably be monitoring the chat and stopping me halfway through if there are like some questions, etc. Because otherwise I will get like really excited talking about calf health and might miss it. So thank you, Cora, in advance for that. But we're going to talk about calf health and what's important, trying to like go like get like an overview so that we are all on the same page about like immunology and vaccines, and then focusing particularly on the main two areas of the presentation, which is vaccinating cows for the prevention of calf diseases, and then talking about vaccinating calves and themselves. I also want to clarify that obviously this is Heifer Academy. We are talking primarily about dairy farms, and we are also particularly focusing on heifer calves that we will like keep as replacement. However, some of the principles that we are going to be using really translate to like beef calves or like beef on dairy or other sort of like surplus calves. But the focus of vaccine protocol development, etc., is really geared towards that heifer replacement target group. If to start with outlining everything, if you are like one home take message from like this presentation, so I'm just going to summarize it to start with. It's basically vaccines cannot solve a management problem. So they're a tool in the toolbox, something that we can definitely use, but the solution to a management issue is not coming in a bottle, whether it's a bottle of a vaccine, whether it's a bottle of an antibiotic or another drug, etc. If you have a management problem, you cannot really control it with shots. So disclaimer there, that's probably the most important message that you can take from like this presentation is that this is not the magic bullet that is going to solve every problem. It's a very important tool that we have if used adequately, but is not the solution. So again, we can use it to prevent diseases, but we can have the wonderful vaccination program that if we have poor management, those calves are not going to be able to mount an adequate immune response. Their immune systems can be overwhelmed by the exposure to pathogens, etc. So again, management is really important, and we always need to look at the bigger picture, not just do I give the shot this day or 2 days later. So why do we care about calf health? Again, I think that one of the issues that we recognize, and it's that worldwide we have a high morbidity and mortality in pre-weaned heifers. These are like numbers from the latest national animal health reports that are run in the US, and they are relatively old already. They were like done in 2013, 2014, so they are over 10 years old, but it's like the latest data that we have. And yes, we still have in the US that they have like the prevalence of morbidity is about like 34% and about a 6% mortality in that pre-wean period. Interestingly, like this study that I mentioned has been done repeatedly over the years, and that's what is represented like in these bar graphs that you can see from these like Jason Lumber and collaborators. Is a study where see if I can get my pointer to work. There you go. The important thing here is like, yes, we have like different years, as you can see, but basically morbidity and mortality, even though we have changed tremendously how we manage heifers on farms, a lot of things have improved, yet the prevalence of these diseases has not changed that much across those years. So they remain a problem. We also have like started to really have a better grasp and understanding the impact or the long-term impact that disease during the pre-wean period has in future performance or future productivity. So if we think about like a heifer that are being born today on our farms, hopefully if we have adequate management, within 2 years, we will have them as lactating herd members. So they are productive members of society, producing milk and paying off all the investment that farmers produce on investment. But we know that This some numbers that I'm going to share, but we know that now that if there's an association between heifers developing disease during this pre-wean period and less optimal performance into that first lactation. So this was like one study that with some collaborations from Extension and here at the College of Veterinary Medicine, we kind of like tried to like quantify that, and we basically found that heifers that had a history of disease during the pre-wean period were between 10 and 14% less likely to make it to calving. So they were like less likely to make it to that productive stage. They had a 5% lower conception risk, and they produced around 360 pounds less of milk in the first lactation, which equals to about like 330-ish kilograms of milk for those international attendees. So again, this is just like an association between a disease in the first 2 months of life with productivity into like 2 years later. So again, it has a huge impact. And if we can prevent disease, we can optimize performance of those animals. One way to like optimize like that or reduce that disease risk and optimize the host responses is by optimizing the immune response. So going to like kind of switching gears and going to cover like about a little bit about like our basics of immunology. So basically the immune system is that tool that mammals and other animals have to fight against infections or like pathogens, etc. And usually we have like those kind of like pathogens, and we try to like characterize, and I'm going to emphasize that a lot through the presentation. For us to better understand how the immune system works, we try to put things into boxes and do like different classifications of systems. However, the immune system really works synergistically. And yes, even though in our head it will make more sense to see them as two independent things, they're actually working alongside each other all the time. So one of the main categories that we use in immune response is like to separate into an innate immune response and an adaptive immune response. And so thinking about it from a pathogen perspective, for like a pathogen in this case, let's think about a bacteria that tries to like colonize the respiratory tract of a calf to develop a BRD. So we had it in the respiratory tract. So the first line of defense, which those are part of like innate immunity. So innate immunities are non-specific defenses. Those would be like the skin, the mucous membranes, and some of like the secretions of the mucous membrane. So that's like the first line of defense, that if the bacteria cannot go past the mucous membranes, then they're not going to be able to infect. Then on the second line of defense, once the first line is kind of like overwhelming, or if the bacteria makes it to the second line, then we have some of our innate immune cells. So we have like phagocytic leukocytes, such as neutrophils, macrophages, etc., some antimicrobial proteins, and we also have like that inflammatory response and fever. I always try to make this point that yes, we always think about like inflammation as like something bad and something that we try to like minimize. And when we think like a calf has a fever, we will give them like a non-steroidal or another drug that tries to like decrease their temperature. However, and that's adequate to do, but we need to really think that that inflammatory response, that pyrexia, it's actually part of like the normal response to the pathogen, and it helps the calf fight the infection. So it's to some degree, it's inflammation, it's a good thing. The problem is that when it's too much, that's when we have issues. And then if that doesn't work, then we get to like the third line. That's when we have like our adaptive immune responses. Those are specific defenses. And that's when we are talking about like our T lymphocytes or T cells, the production of antibodies, and the development of memory cells. So that kind of like adaptive response is like a specific for each pathogen. And really, when we think about vaccines, this is really the arm that we are trying to work on. So our main goal with vaccination is to work on the development of those memory cells so that the next time that the animal sees something that resembles what we vaccinate them with, they are going to have like memory cells, and they're going to be able to mount an effective and fast immune response. So again, re-emphasizing these, also as I mentioned before, we have like our kind of like boxes of like innate immunity and adaptive or acquired immunity. And with each component, we have both cells and then like other humoral or soluble components. So as I mentioned again, innate immunity is this really fast response, but it's not a specific. So it is a genetic response to like simplifying things. It should respond, the innate immune system or the innate immune response should be the same for bacteria A than for bacteria B because it's a generic response. It's not identifying those bacteria as something different. Uh, they have no memory, but they have like the good thing that is like quick or an immediate response. So we are talking about like minutes to hours for this generic response to develop. And within the components, so we have like our phagocytic cells. So we have like neutrophils, macrophages, natural killer cells, and we also have like some kind of like soluble components such as like proteins of the complement system, the inflammatory response that I mentioned before, and those like physical barriers like the skin, etc. On the other side, we have like our adaptive or acquired immunity. Those are compared to like the innate one, those produce a specific response to pathogens. So they are not going to respond the same to bacteria A than to bacteria B because they're being able to recognize that they are different. And particularly if they have seen bacteria A before and not bacteria B, they're going to produce a faster immune response for bacteria A because that arm of the immune system has the capabilities of producing memory. However, one of the caveats that we have that, well, we're saying that the innate immunity is quick and immediate within like minutes to hours. For the acquired immunity, that takes time to develop. So it's like a more specific response, but takes more time. And by time, we're talking about like several days to mount. So again, and remember that this is like the arm of the immune system that we are trying to work on when using vaccines because our goal is to generate memory. But again, those kind of like classification with different boxes try to make things very different. However, they really work very synergistically. So I like really the like these graph that is downloaded from like this website. So that really tries to like say that okay, like the different types of like immune cells are like law enforcement, and they're like different types like law enforcement, and kind of like each of them kind of resembles a different type of like immune cells. And part of like what we want in a functional immune response is for the immune response to be proportional to the damage or the pathogen that is being caused. So and that's seems to resemble well with law enforcement. So we have, for example, our neutrophils, which are like the street cops. Those are like the ones that produce a rapid response. So let's imagine that your neighbor's kids breaks one of your windows, and well, for some reason you need to call the police. You obviously, yes, that's probably something that a street cop can deal with. You don't, for example, would need to have the SWAT team come to deal with that issue, right? So that's like the same implication. So it's kind of like goes through different layers. So then we have like our dendritic cells, which is like our kind of like signal man. They're like the one that kind of like interacts between the two types of like innate immunity cells and adaptive immunity to control. And then we have like our really specialized forces like the SWAT team. Those are like the adaptive immune cells. And again, they really like everything really interacts, particularly like the command center. It's really like the secondary lymphoid organs, like such as lymph nodes, etc. That's like where kind of like the innate immunity cops are going to talk to like this SWAT team or our lymphocytes in this case. So again, that's kind of like everything gets orchestrated, and they kind of like they really talk to each other and work together, even though we kind of classify them as something different. Other important thing to really take into account that not a lot of a good thing is necessarily good. And a lot of the times, like what we see in terms of like disease severity, it's a reflection of the strength of the immune response. So to put an example, when we think about like inflammatory response, or we talk about like those street cops or like the neutrophils, those are like the ones that are the first responders that they have the capability of like destroying pathogens, etc. And if you think about it, like when we think about pus is basically the debris of several, like millions of neutrophils that have been like destroying bacteria. To some degree, for example, if we think about like accumulation of pus, so you have like a good neutrophil activity, which would say like, hey, this is like strong immune response. It really depends on what it happens. Some of the issues, for example, is like if we had metritis, which is accumulation of pus within the uterus, and the cervix is open, that pus has somewhere to go. So you might think, hey, some degree having pus is a good thing because that means that the cow has mounted an immune response and it's hopefully could be clearing that bacteria. Now, if that same were to happen in the respiratory tract, which is what we have here in this graph, the issue is that that's not an open space. So really that pus has nowhere to go. It accumulates within the lung, and therefore it reduces the capacity of those calves to like do like the air exchange. Like basically that area of the lung is no longer doing its function. And that's why we see some of like the clinical signs of like heavy breathing, etc., just because we are reducing the lung capacity. So there's like, again, to some degree, the level of pathology of the level of the disease can be attributed to a strong immune response. So again, immune response is really good, but too much can be detrimental for the animal. And that's, for example, one of the examples that you can use for like why, yes, inflammation, it's a good thing, but we need to sometimes try to reduce it. Now, if kind of the immune system seemed like easy enough, now we get like more complicated when we talk about a calf immune system, or you can really change the term calf and really talk about like any neonate. Calves get like even more complicated, or like ruminants in general, because of the types of like placenta of ruminants. There is no transfer of immunoglobulins or from like immune components from the dam to the calf in utero. So at birth, calves have no antibodies in serum, and with the exception, and we'll talk about that like later. So calves actually in fetuses have an immune system. So, but they do not, because in theory they're in a sterile environment, they are not going to mount an immune response. But there are like pathogens that can cause what it's called like an intrauterine infection. So if a fetus gets infected with sufficient time, they would mount an immune response, and then we would have those antibodies. But in general, think about a healthy calf that has not been infected in utero. When they are born, they basically have very low, almost negligible amounts of antibodies in serum. And that's why the transfer of passive immunity of like those antibodies through colostrum intake is like so important. However, even though yes, they do not have antibodies, calves are actually born with all the immune cells of a mature immune system. The problem is that for calves, because they are just born, that immune system is naive and immature. So it does take time for those responses to be effective and protective. In fact, like the responses that we see in neonatal calves do not really match the magnitude of the response that we will see in an adult cow until those calves are like 5 to 8 months of age. So again, like immune maturity doesn't really happen until calves are or heifers are about like six-ish months. But again, those calves are born with immune cells. They are born with an immune system. It's just that basically the immune system works, as we've like discussed before, based on exposure and the development of memory. And because these calves have not been exposed to pathogens before, they just don't know how to respond, and they take more time to like develop functional responses. But in fact, as I mentioned, calves are born with like the same, with like very similar concentrations of like immune cells in blood. So this study that I'm showing here, you can see that basically the amounts of T cells, which are like this like blue line, like the CD4s, gamma delta T cells, CD8 T cells, for the most part, with the exception of B cells, the concentration of the different types of like lymphocytes in blood of calves remains constant throughout the first months of life. And the only exception is like B cells that are like the one that like their amount kind of like increases over time. B cells are the cells that are in charge of producing antibodies. So basically what it means is like, so yes, we might not have or might have like a weaker antibody response, but we have like the same number of other like lymphocytes. So for all like cytotoxic responses, etc., we should be able to have a cell-mediated immune response very early in life of calves. But because of this like gradual increase in the number of B cells, so calves must be at least 3 to 4 weeks of age before we can have a robust systemic antibody response. And again, that systemic antibody response really doesn't happen until 2 weeks after we vaccinate them. So again, we started to think about, okay, calves need to be about a month age and a month old, and then we have to like wait for like 2 weeks. We are already talking about 6 weeks of age before they are protective with antibodies. However, again, a lot of the responses that we see are cell-mediated, and that's a good thing. I just making like this point because for a very long time, the only way that we as immunologists had, or that we were like measuring immune responses was based on just measuring antibodies. And that's why we kind of had like some misconceptions like, oh, calves do not really mount an immune response early in life, etc. It's just because we were only measuring antibodies, which is like the only component that you can see that increases over time. So really what happens in the calves in terms of like antibodies is that you have like these, okay, they're born with antibodies. That's why they ingest colostrum. So they have this peak of maternal antibodies that produce protection for the first few weeks of life, and then then they start producing their own antibodies, which generates this kind of like period of risk. So our job really to optimally manage these calves is to try to like increase that amount of maternal antibodies so that the slope is lower. So we have like a more like gradual decay of maternal antibodies, and at the same time stimulate the production of antibodies by their own calves. So we are trying to like narrow that gap by increasing kind of like both ends, if that makes sense. And that's where we're again, for the focus of this talk, we're going to talk primarily about active immunity. So we are not going to talk a lot about maternal antibodies, but because again, I would probably need another hour or two if I were to like be talking about colostrum. So again, talking about now switching to the basics of vaccines. Why do we vaccinate? Again, our major goal is to generate memory. So I always said like after COVID, talking about immunology and vaccinology, it's way easier because everyone has had like heard like some of these terms. So when we think about like vaccines for like again like the developing of memory, so we are also talking about like sometimes you think about like your first shot and your second shot, etc. That's like your priming vaccine and your memory and your booster. So again, when we think about your primary response, again, this is just looking at the antibody titers or like antibody concentrations, and they're like different classes of antibodies. But if we just look at like total IgG, which is the most common one, you see like that have like a kind of like response to like that priming vaccine. That's when we have like a first exposure to the antigen or like the pathogen in the vaccine, and that kind of like at some point resolves. And after it resolves, we kind of like expose the animal to that same antigen or pathogen again. And because they already kind of like developed some memory because of this first response, then now you can see that you have a faster and greater response in terms of antibodies. That's really what we want. So for the most part, the first time that we vaccinate something, then we have like these priming and booster vaccines. And then same thing that happens with vaccines in humans, we might be okay with just like annual vaccinations for several diseases. So when we think about what happens when we kind of like inject a vaccine, again, I'm trying to talk about primarily now parenteral vaccines. So we inject the vaccines and we primarily, again, see our goal, again, is to work with the adaptive immune response because we want to generate memory. But again, the ones that are the immune cells that are actually going to like detect the antigen or detect the vaccine are cells from the innate immune system, such as dendritic cells. Those are cells that we call antigen presenting cells. So those are like cells that will like say like, oh, this is something foreign. I'm just going to go take it to the command center, go back to the lymph node, and present it to some of the lymphocytes and see what they can do. Now, those antigen presenting cells, then they will like present the antigen, and we can have both like a CD4 T cells, or basically those. It ends up with the production of or like stimulation of B cells and production of antibodies, and also like the generation of memory B cells. So we have those antibodies, and we also have like our CD8 T cells. So those are like the cell-mediated lymphocyte functions. Those are like the ones that have like effector cells that we'll talk later, and memory cells. So on the one hand, we have like antibody production. Things to consider when we talk about like antibody production, that's also to some degree, it's considered like soluble immunity. So antibodies, for example, are released into blood, circulation, and other tissues, and they might like attach to cells, but they are not really, if, for example, when we talk about like viruses, most of the viruses are intracellular pathogens, so they are going to like infect cells. So antibodies do not enter inside cells. That's why we need our cell-mediated immunity, which has cytotoxic effects. So those are like the immune cells that are able to detect, oh, you're an infected cell, you probably should die. And those are like the ones. So that's how you have like those kind of like, that's why both arms are important, right? So you have like our soluble immunity and also that kind of like cell-mediated immune response. And again, depending on one might be more important than the other, depending on which pathogens are we necessarily targeting. And a lot of that will go when we talk about later about are we dealing with an intracellular pathogen or not. Another important thing to consider when we talk about, again, I already mentioned like the priming and booster that need to be separated. It's try to think about the interval between doses. And I'm highlighting this, it's kind of like our thought process kind of has like changed over the last few years based on like new evidence. So when we think about a response or a T cell response, so obviously we have our recognition, we have our antigen presenting cell, then we have like that proliferation of immune cells that results in generating of like antibodies, and then we have like that memory response. But there's the same thing that we have like an activation phase, and then we also need to have a declining phase. So at some point, all those cells that have been formed need to regress and die so that we only keep those memory cells. And that basically is what dictates how spaced out the doses between vaccines should be. Because if we vaccinate too early, we might end up into like something that is called like T cell exhaustion. So where we have here, again, this has been showed like for like chronic infection, cancer, and also like if we have like really repeat vaccination. So usually we have our kind of like maturation, we have effector cells, and then we have like that declining phase, and that's when we have like the generation of like memory cells. So that's what is on the left. It's like the regular process. If we have continued exposure, so there is not that decline, so that those kind of like T cells at the top of the response, they're going to try to keep going because there's like a repeat antigen exposure, etc. And at some point, they're going to get like really tired. So that basically turns that those precursors, instead of like turning into, they just get exhausted or fatigued, and they just do not result on memory, which is what we really want with vaccination. So basically, what does that mean for us trying to vaccinate cats? That when we have like that response, we need to allow for like the expansion and apoptosis of those like lymphocytes. So those lymphocytes, we have to have like that kind of like whole going up and down. We need to have like expansion, and then those cells need to die so that we only remain with the memory cells. That process takes about at least 3 to 4 weeks. And to some degree, it really depends on other characteristics of the vaccines, because some adjuvants might maintain the antigen for longer. So consider like 3 to 4 weeks. So that basically means that for like our space between a prime and a booster vaccine probably should be at least that much. And I mean, I'm saying that because before, like the traditional thinking process was that we needed just 2 weeks. And that's and a lot of the vaccines that have been commercialized years ago, that's what their label would say, like vaccinate and then boost 2 weeks later. Kind of like now we know that we usually get a better response if those prime and booster vaccines are more spaced out. Other important things to consider when we talk about vaccinating animals is what types of vaccines are we using. There, as you can see on the right-hand side of the graph, there are like multiple types of vaccines available of different technologies, etc. For the most part, and again, this is one of the areas like being very US-centric. For the most part, we are talking about two major types of vaccines. We are talking about like a modified live vaccine or an inactivated or killed vaccine. So a modified live vaccine usually compared to like an inactivated has longer duration of immunity and it's a more robust immunity. And it's thought to be better for cellular immunity. So again, that goes back when we were thinking about like, hey, antibody response is just soluble versus that cell-mediated immune response. So cell-mediated, we can generate it better with a modified live. So for that reason, it's considered to be better for immunological memory. However, we are really talking about a modified live vaccine. That means that we have a live pathogen in the vaccine that, yes, it has been modified through various methods for it not to cause disease. However, it can still cause disease sign, particularly if we're vaccinating like immunocompromised animals. So yes, it's a modified virus or bacteria, but it's still a live organism. That's really important to think about when we think about, okay, if what we are vaccinating against is an abortifacient pathogen, for example, if we are vaccinating about BVDV or like bovine viral diarrhea virus that causes abortions, and that heifer it's pregnant and it's like the first time that it's getting exposed to that virus because the virus is modified, but it still has like that kind of like tropism for the reproductive tract, it's still going to target it, so it can still result in an abortion. So that's why it's important not to use for like prime and pregnant animals. This issue is not that important if the animals have already been vaccinated with a modified live vaccine that has the same strain of the virus before the cow becomes pregnant, because usually that there's already some memory and protection. But also important, like again, the other group, the inactivated or killed vaccines, and I always say like this includes toxoids. Toxoids are really vaccines where we are not vaccinating necessarily against the pathogen itself, but against toxins that pathogens produce, which are what they cause disease. And examples of that are your clostridial vaccines. Those are really what we are vaccinating against are the clostridial toxins, not the clostridial pathogens. So those types of vaccines usually are produce a more short-lived systemic immunity. So that's why like boosters are more important to kind of like continue to generate an immune response, but they are like safer in terms of like, hey, these have been inactivated or killed, so there is no live organism in there, so they do not lead to disease or signs. However, again, these like early classifications, vaccine technology has evolved tremendously over the last year. Now, both they're like adjuvants in both modified live vaccines and inactivated vaccines that improve the response for all type of vaccines. So adjuvants in general terms are like other substances that get added to the vaccines to enhance one way or another the immune response to the vaccine and generate a better memory. So there's kind of like other things that get added to those vaccines to make a more robust response. When we think about like the types of vaccines that we use, again, the different pathogens that might be involved are going to also elicit different types of responses. So in broader terms, and to some degree, this is oversimplification, but if we just classified pathogens as either intracellular or extracellular, that means does the pathogen lives inside the cell or outside the cells? So for an intracellular pathogen, what we really like, they usually cause more. That's what it's needed to clear that pathogen is what it's considered a T helper 1 or Th1 response. So that type of response is geared towards increasing killing and phagocytizing of cells. So basically what we want to see is like, okay, the pathogen is intracellular, so we are going to destroy the infected cells. So that's why we want a really strong cell-mediated immune response, because we need to destroy the cells that contain the pathogens in them. So examples of intracellular pathogens are bacteria such as Salmonella, Listeria, Brucella, and most of the viruses that we are dealing with in calves, such as BRSV or IBR, etc. For extracellular pathogens, those need and elicit more of a T helper 2 response. Examples of extracellular pathogens are bacteria such as Staphylococcus aureus, E. coli, or Mycoplasma. For these ones, because they're kind of like floating around to a certain degree, what we want is like those like antibodies that are soluble immunity that are going to bind to the pathogens and block them to making any damage. So that's why we want those antibodies. So we want a more like a strong immune response. The thing with like these types of responses is that they are really kind of like two sides of a balance. So if you have more of a Th1 response, Th2 decreases, and vice versa. So when we think about vaccines and what type of response we want, so usually modified live vaccines generate, again, this is oversimplifying things, but they are more heavy on the Th1 response because we want that cell-mediated immunity through and that happens because of the activation of macrophages and the T cell cytotoxicity, whereas kill organisms generate more of a Th2 heavy response. So it's more of a B cell proliferation and differentiation, so more of like an antibody response. So again, that might basically to some degree guide us. Again, obviously safety needs to be considered depending on which animals we are vaccinating. And okay, if we are dealing with an intracellular pathogen that I really want more of a Th1 response because I need that cytotoxic response to remove intracellular pathogens, then I probably would rather use a modified live vaccine over a kill vaccine if, again, the safety of the animal allows it. In terms of is it pregnant or not? Is it safe to use that type of vaccine? Right? Like I always say, some immune response is probably better than non-immune response. So this is kind of trying to simplify things. Other ways of really classifying vaccines other than modified live and kill. So really this affects different types, is either classifying them by the route of administration. So again, this is really a parenteral vaccine, which is usually an injectable vaccine, or for example, it's an intranasal vaccine or an oral vaccine. It's delivered through the nose or orally, and we'll talk a little bit more about that. Other ways of classifying them is really by the type of license that those vaccines went through that are available in the market. So for example, in the US, we have commercial vaccines. So those vaccines have to go through an USDA licensing process. So they actually have to demonstrate safety and efficacy of the vaccine for the label claims that they have. And actually now for the vaccines that have been licensed recently, you can go into the USDA website and read about the studies that were done for efficacy and safety of those vaccines. Then we have those autologous vaccines. Those are for the most part, those are vaccines where you actually gets an isolate of the pathogen that is affecting your herd or a neighbor's herd, and you just send it to a company, and they kind of create a custom-made vaccine against those specific pathogens. However, because of the types of vaccines of license, they cannot have any claims of efficacy because the USDA is not reviewing. Yeah, and for the most part, autologous vaccine are only killed or subunit vaccines, so they are not modified live vaccines. However, several of those have like really potent adjuvants that help its use. So again, sometimes with like commercial vaccines might not work, an autologous vaccine might be something useful. And like something newer are like prescription platform vaccines, but that's like a new license type that has been released by the USDA recently, but is starting to come out into the market. And those are just basically where like the approval is about the platform system for the vaccine, and then once approved, they just kind of like switch the different antigens. So it's like a way of like generating vaccines to different pathogens faster than the old-fashioned way. Okay. Do we have any questions so far?
No, we haven't had anything come in.
Perfect. Thank you. So switching to the more practical side, now that I've bored you all with immunological concepts, is again trying to think about how we can use or vaccinating the cows or vaccinating in this case like the dam for calf health. There are like obviously way too many things to talk about vaccinating adult cows and to cover in like the time that I have with you. So we are just going to focus on how can we use it for calf health. Again, why is it really important? We'd already touched a little bit on passive immunity, so colostrum is essential. There is no transfer of immune components in utero, so all the passive immunity is acquired after birth through colostrum. And colostrum has the largest influence on calf survival and is particularly important for the prevention of diarrhea and also pneumonia, but to a lesser extent, primarily because if you think about like that kind of like graph that I showed earlier, with like the decay of antibodies from colostrum, we usually see pneumonia starting at weeks like 4 or 5 or something like that. That's like the time where like colostrum has already, antibodies from colostrum have already declined. But so it's still important, but not as important as for diarrhea. And again, measuring passive immunity is really important. And this has something that has been like changed recently. So many farms, we routinely use serum total protease or BRICS in the blood of the cows or like serum of the cows as a proxy to their IgG or immunoglobulin or antibodies status. And traditionally, we just had like this classification as like fail or pass. So it's kind of like this kind of like yes, no approach. And in recent years, we have been like new categories, kind of like the pass has been like broken down into like different categories to really classified good immunity. And that's like this, like a study that kind of like proposed these categories. It also like recommend, okay, if you had an optimal colostrum management program, this is like the percentage of calves that you should have on each of these categories. So I'm going to kind of like talk about like why is this important. Like, so this is a study that former student of mine conducted a couple of years ago, where he really looked at why does it really matter. So really classifying, again, as you can see, those were almost like 4,200 dairy calf records. So we had like a lot of animals included in this study. And you can see basically that as the category of serum total protein or like of passive immunity declines, there is a proportional increase on the risk of calves to develop diarrhea. So it's a complete like kind of like linear relationship, right? Like the compare our 1.0, so our bar will be like the calves in the excellent group. So you can see how there is a proportional increase on that risk. However, for like pneumonia, that kind of like matches what I was telling you before. We only saw like a statistically difference between poor and the rest. So yes, calves that were in the poor category that have inadequate passive immunity had a greater risk of developing pneumonia than calves in the excellent, good, or fair, but we really saw no difference between those three. So again, it has like an impact, but the impact is greater on diarrhea than in pneumonia, but that is primarily have to do with the timing of when those diseases usually happens. So again, obviously colostrum is really important. We try to prevent those diseases, so we have to like optimize what type of antibodies we are giving those calves. And again, as I mentioned, colostrum is primarily for the prevention of diarrhea, even though anything can really get prevented. So we can use vaccination to improve the quality of those or the amount of those antibodies targeting those specific pathogens that we want. So our goal of like vaccinating cows is to provide a specific, or one of the goals is to provide a specific immunity to the calves via colostrum. Because basically colostrum gets generated by transferring immunoglobulins from the blood of the cow to the colostrum. So if we increase the antibody concentration of the dam in the blood, we will increase those antibodies in colostrum. So what we want to match when we think about timing of vaccines is that maximal antibody response to happen at the time where colostrum is being generated. And again, it's like an image from my colleague Sabina Mann from Cornell, and you can see that really colostrogenesis is start about like 4 weeks prior to calving, but like the maximal transfer of IgG really happens in the last week before calving. So you start thinking putting everything together, and obviously we have, okay, it's like the first time we have like a priming and a booster vaccine, and after the booster is when we have like that maximal response, which is what we want to match with our time of like maximal transfer of immunoglobulins to colostrum. And I already told you that at least you have to have like 3 to 4 weeks before booster and priming vaccine. You just can already like figure out when you have to like start vaccinating cows for that. So important to think, particularly because in at least the vaccines that we have in the US against diarrhea pathogens in calves, for the prime vaccines, so like usually for heifers going to their first lactation, that requires 2 doses. So that's when you basically have to like give them like 2 shots. For like the label says that for like calves that have been already vaccinated before, only 1 shot. So like in their cows that are entering their second or greater lactation, usually just 1 shot is sufficient. But we want to match that kind of like booster shot with like that time of maximal transfer. And there is evidence of that this approach really increases specific antibodies against several pathogens. And yes, several of those are against our common culprits in diarrhea, such as E. coli, rotavirus, coronavirus, salmonella, clostridium, also cryptosporidium, and also some respiratory viruses such as BRSV. Critical part, right? We can do like the best job and have like the best quality colostrum that farms don't have a really good protocol and we don't get sufficient amount of colostrum in a timely manner into the calves, then we are not going to make it. So, and the question is also sort of, okay, how long does that colostrum protection last? So again, this is likely to be different from each pathogen, and there's not enough data for every single pathogen. This was like one, like need a study from some researchers in Europe, like vaccinating dams, and then they did like a VRSB challenge from their in their calves, depending on whether or not they receive colostrum from vaccinated cows in the blue or non-vaccinated cows in the red. And you can see that calves that had and that VRSB challenge was done at like 21 days of age. So you can see that they had like worse clinical scores or like worse clinical outcomes, and also they shed more virus than the cows that actually received the immunized colostrum. So what we can conclude for that is that at least seems to be at least 21 days, but there's really no data to really go anywhere beyond that. Another way that we can use vaccination in the cows to prevent calf diseases is really trying to match those intrauterine infections. So what we want to do with like having cows vaccinated is to prevent those calves from being born infected. So some examples of pathogens that can be transmitted before the calves are done include viruses such as bovine viral diarrhea viruses, blue tongue, etc., and some bacteria such as salmonella. So yes, vaccinated dams can prevent or decrease disease transmission, and some of that is something that's like routinely done in most herd vaccination programs, particularly like for BVD. That's like the main goal for preventing the development of persistently infected calves. So we vaccinate the cow so that if she gets infected, doesn't transmit it to the calf and the disease transmits. However, that's more of like a novel and more like a greater issue on farms currently. It's salmonella, particularly salmonella doubling. It's another disease that causes intrauterine infection, and it's going to show some data that we have. So from a study that we completed here recently in Michigan. So we know for like Salmonella Dublin that calves get infected either vertically, so there's like that inter-infection, or because those kind of like carriers or positive animals shed the bacteria in feces or colostrum, and then cows get infected when they ingest it. And it's a really tedious disease because it's a range of sickness, has high mortality, and it's also a zoonotic agent, so it can infect humans. So we did like this study that I'm referring here with some like collaborators from again Extension and the diagnostic laboratory and a pharmaceutical company, where we enrolled 4 cows and 4 farms, sorry, and we screened over 1,000 cows for carrier status, which on its own, it's already a very tedious job to do. That basically almost like requires like 6 to 8 months of repeated testing, because they need to be like testing across like 3 different test points. So we ended up identifying 3 farms and almost 150 carriers of Salmonella, and then we randomly allocated those carrier animals, so carriers that were infected with Salmonella and that were carrying the Salmonella, and so we split them, and half of them receive a commercially available live culture vaccine at dry off, and then they were like booster 2 weeks later. And then the control group received just basically a saline injection at dry off, and 2 weeks later. And yes, I know that I told you that we shouldn't be vaccinating like 2 weeks apart, but this vaccine we had to conduct the study according to the label of the vaccine. This vaccine is still labeled for a booster 2 weeks later. Then at the time of calving, we collected like feces and colostrum from the cow to kind of try to see like decreased shedding. And we also collected pre-colostrum serum from the calf to assess intrauterine infection, which is like the data that I'm going to focus on. So for the calves, what we found, again, if we just think about first look at the control group, so we basically found that among the calves in the control group, from again carrier animals, we found about like 17% of the calves were already infected by the time that they were born. So at least 17% of the calves were already infected by the time that they were born in the control group. So interestingly, the calves that were born to cows that have been vaccinated, the risk of being born infected was significantly lower. So it decreased for over like 5 times in the risk of being infected. And this is like something that we are doing some follow-up work on, but basically these data suggest that vaccination of cows against Salmonella Dublin, as implemented in this study, might be like a tool that we can use to like decrease that intrauterine transmission and preventing those calves, or at least reducing the number of calves that get born being infected. So was there a question coming through?
Yeah, question came in. So the question is, when should vaccines ideally be given to the cow prior to calving? Many vaccines still suggest 3 weeks prior to calving, but there is some discussion that that may be too late.
Yes. I mean, it is a balance, because obviously we have like expected calving dates, and cows never like to read the book and math the math. So obviously like expected calving dates are just an estimation. I would to some degree agree that 3 weeks, again, if you think about, again, you want like our maximal response. I'm assuming that this is for like the colostrum transfer part. So if we want our maximal response at the time of like 1 week prior to calving, I would probably like move it like to 5 to 4 weeks, just because that gives you like still like sufficient time for like, again, you need like those 10-ish days to get to like your maximal response, and that you want that point to match your last week before calving. So that way you're kind of like covered, even if the calf were to calve a week earlier or a week late, if that makes sense. So and again, we're thinking that in general we are seeing that cow, like the calving, like the pregnancy length of cows tries to be like shortened. So calves start to like calf earlier. So that's probably, it's almost like a more like safer approach, I would say. But it's to some degree, it's a play of math because if we knew which day and time calves were going to be like calving, everyone will be happier. Okay, well, hoping that addressed that question. Going to move on to vaccinating calves. And again, these are like typical questions that I hear about vaccinated calves, like how early can we vaccinate them? What about like famous maternal colostrum interference? And how much can calf immunity be improved? So things to consider that we talk about, like also like intranasal vaccines, etc. So the lymphoid tissues, they're really rich on immune cells. So that includes like intestine, respiratory tract. So those respond really rapid to pathogens. And there are like some evidence that shows that vaccination against oral coronavirus at birth, and then calves are already resistant to disease just 3 days after. And for the most part, that kind of like localized response is driven by IgA. So before, when we talk about like systemic vaccination, I was primarily focusing on IgG, but now we are really more like at the localized level, we are looking at this like secretory IgA, which matures faster than other immunoglobulin response in calves. And it also has the capability of like what it's called like opsonizing. So that basically means that it binds to the virus and prevents the virus from actually infecting the cells. And that's like, if you give an intranasal vaccines, that's really what we are trying to accomplish, like increase that amount of immunoglobulins in the localized tissue. However, it's important to consider that they are not separate compartments. And even if we can like give a vaccine through the nose, those immune cells are going to like migrate, going to go to like our lymph node, and they're going to like interact with immune cells in the bloodstream as well. So even we can prime systemic responses by the administration of intranasal vaccines. However, very important, same thing as we were talking before for like parental vaccines, any immune response also takes time to develop. So yes, localized immune response develops faster to a certain degree, but it also needs time. So if we give the vaccine today, we cannot really expect that the calf is going to be protected the next day, right? So we are really, I know that a lot of farms are really vaccinating calves at birth or in the first week of life. Again, we are really looking at giving it that early. We are probably not seeing like protection for like a few weeks after. And this is like some data from one of my former grad students' studies, just to show where, again, we look at like immunoglobulin A for different respiratory viruses in the nasal secretion of calves. This is, and you can see that kind of like gradual increase across age that peaks about like that 6 weeks of age. And after like those 6, we have routinely seen that in several studies. We have like then we start to see like a decline on the amount of immunoglobulin A. But again, this is to some degree relative because we don't have like the cutoff point to say like this point is where IgG levels start to be protective or not. But we know that maximal response appears not to reach until like 6 months after the administration of vaccines. And these cows were all vaccinated at birth. Now, on the other hand, we have like those injectable vaccines. Again, as we discussed, the systemic immune response is more immature. So we are not going to see responses to parenteral, like injectable modified live vaccines until calves are like at least 1 week of age. And also to again take into account, as I mentioned before, modified live vaccines are risky, and the viruses that we have, they still kind of like behave like a virus. So for example, BVD virus is an immunosuppressant virus. So even like modified live vaccines has also like some degree of like immunosuppression capability. So we are thinking about calves that already have like an immature and not very robust immune system. We probably should not be giving vaccines with immunosuppressant viruses or modified live vaccines with immunosuppressant virus. So probably avoid giving a modified live vaccine with BVD until calves are at least 2 months of age and they already have a more robust immune response. Also important to take into account that vaccine is more effective in these young calves against viruses because bacterial vaccines usually they don't get much of a response unless calves are like older than 3 weeks, with the exception of like toxoids. Again, those are like the vaccines that target toxins. because you can see responses really early on for those type of vaccines because they kind of like mount an immune response through like a different path, since again, they were not a pathogen, but a toxin. Another important part, again, this is part of what I mentioned before, like for many years, we've been measuring immune response solely based on antibody responses. So we always claim, okay, we cannot really vaccinate in face of maternal antibodies, so we cannot, or colostrum interferes with vaccination, and that's why we cannot vaccinate calves parentally that young. So that kind of vaccination in face of maternal antibodies, usually it's been considered ineffective because of that failure to increase antibodies, because that's what the only thing that we were measuring. And the rationale was like, okay, we have like our vaccine antigen, and what happens is like those maternal antibodies in the bloodstream do the same thing as we would do with for a pathogen. So they bind to the antigen, and then there is no presentation of the vaccine, and they don't mount an immune response. Really, what now we know is that yes, there is an interference, but that interference or inhibition only affects the B cells. So it only affects the cells that are targeted with producing antibodies. So yes, we do not see antibody production, but that cell-mediated immunity is largely unaffected by colostrum. So we can still vaccinate calves that have good passive immunity through colostrum, and we're still going to see a cell-mediated immune response. And there's like a lot of like trials that have been done in recent years that basically show that yes, we don't see an antibody response when calves are vaccinated in terms of maternal antibodies, but we do see a T cell response, and that response is actually protective against infection in both challenge and field studies. So yes, calves can respond to vaccination in face of maternal antibodies. It's just that we don't really see an antibody response, but we still have a cell response. Other things that kind of like changed, like obviously when we usually thought about it, is like, well, we always thought that when we were like giving a vaccine parenterally or injectable, we have like that only have like systemic immunity or that IgG response. And when we had like that intranasal vaccine that I mentioned before, we have like both that localized and systemic. So we have like that increase in IgA that then kind of like moves and produce like priming of the systemic immune cells, and we have IgG response. And now we know that this is not really the case. And again, it really depends on the adjuvant. So it really depends on which vaccines are we doing. But even commercially available injectable vaccines can generate a mucosal response. And this is like a study from colleagues at South Dakota that have done a few years ago, where they like vaccinated calves in face of maternal antibodies with a parental vaccine. And then they did like a challenge study with respiratory syncytial virus, and you can see that so this is like the IgG levels in the nasal secretion. So calves that were like in the group 1, which is like the vaccinated group, they had, even though they received a vaccine parenterally, and even though the vaccine was given at the time where they have passive immunity, they still generated a localized response. And the same thing happened with like really was also like protective for like viral shedding. So it did have a fully protective response. So what really happens here again is like that kind of like the immune cells are not like stuck in a compartment. They can like rotate through. So even like vaccinated in one area basically results that those immune cells eventually will make it to others once they are primed. And I know that I'm going a little bit over time. I just want to do like a couple of like pointers about considerations for developing vaccination programs. So I think that part of things of considering, going back to like my early message at the beginning, vaccines are only part of like disease control and prevention. And again, we cannot overcome management. We also need to do like some testing to actually know which pathogens and which strains are happening in the farms that we want to vaccinate. And that's going to inform which vaccines we use, and particularly when to use them, because we want to target the time of vaccination to the time so that the animals that we are vaccinated are protected at the time of onset of disease, which is going to be very different from farm A to farm B. So again, those vaccination programs need to be based on testing strategies for each farm because the pathogens, even if it's like the same, even if it's like salmonella, it might not be the same strain in one farm than another. So that might be different. In one, calves would get sick at like 8 weeks of age, and in other ones, you're not going to see like disease until like 12. So that's going to inform when you should be vaccinated. So again, it's very important to specify which pathogens are involved in a specific disease at the herd level, and which specific strains. Because I mean, for some pathogens, cross protection is possible, but it's not always guaranteed. Like for example, there is evidence that vaccination for one type of salmonella does not offer protection against infection with another strain. So that's why kind of like makes things like complicated, and that's why you cannot have like a blanket vaccination program for every farm. And this needs to be like tested. And again, it's also important to revisit the vaccination programs on each farm and doing this on a regular basis. Like, as I mentioned, we want to have like full protection. And again, full protection doesn't happen until 3 to 4 weeks after the booster, uh, before the period when we see diseases breaking in each farm. And again, remember that I already also told you like 3 to 4 weeks between prime and booster. So again, we are basically, I know that it gets harder when we're talking about like vaccination of calves, right? Because a lot of the times calves get sicker before they're 8 weeks of age, which would be like what almost like all the timeline that I gave you. So sometimes we just have to do what we can. But that's like, again, that's like the ideal world, which I understand not always represents real life. And also important as we kind of revisit vaccination programs that yes, we might need to add new vaccines if new diseases are important, but also it's very important to remove vaccines as needed. I see like all the time, vaccines get always added. Very frequently, they get removed from a vaccination program. So again, sometimes maybe have to really evaluate whether that this is still a problem or not. And I know that yes, vaccines are like to a certain degree are cheap insurance, but over vaccination, it's a thing, and it can lead to like that immune cell depletion and exhaustion that we talked before. So it can actually have some bad consequences for like, the immune response against other pathogens. And also important to take into account that vaccination, like the mounting of an immune response, always costs something to the animal beyond the cost of the 2 mLs of the vaccine. So to mount an immune response is a very energetic, demanding process. So that's like energy that the calves or the cows are putting into mounting an immune response that are not being used for like milk production or growth. It's basically a drain of glucose that is otherwise not available for growing or producing milk. And the same thing that happens to everything with any immune response, reactions are rare, but also the odds of having an adverse reaction are going to increase when we give more vaccines and when we give more shots. The more we use, the more then we are increasing, like the likelihood is really the same, but as we increase use, we are going to see more, potentially see more adverse reactions. And that's all I have. I want to thank, like, again, my team for doing all the work while the one that gets to have like the fun time and going to farms and being here with you. Also acknowledge all our labs like funding sources, and hopefully we still have some questions and some time to have a chat.
Yeah, absolutely. Since we're here, we can definitely answer a few questions. So, I am going to take over sharing quick. With the folks that are still here, if you have some time, fill out the post-session survey. You'll get that link as well in the follow-up newsletter if you want to focus on the Q&A real quick. So I do have two questions. The first question is, during my time when I've worked with vets, I have heard in relation to vaccines, gram-negative and gram-positive vaccines. Could you explain what that means?
Yes, it really depends on like which type of bacteria the vaccines are. So, if, for example, Staphylococcus aureus is a gram-positive bacteria. So, if we are vaccinated against that bacteria, we will have like a gram-positive vaccine. And I probably chose a really bad example of bacteria because probably my colleagues that do other health will probably tell that you should not use it. Anyway, I don't think I'm not even sure that we'll any longer have that in the market. But that's like one example. For example,
Right.
an E. coli vaccine. E.
Hmm.
coli is a gram-negative bacteria, and that just basically has to do with like the structure of the wall of the bacteria. So when we have like a vaccine against E. coli, we're having a gram-negative bacteria. Now, why is this important? And obviously, I didn't really cover that. So, gram-negative bacteria have endotoxin. So because of the structure of the wall, they are really endotoxin. So it's what we try to avoid when vaccinated is like endotoxin, what is called like endotoxin stacking. So it's basically like if we give too many gram-negatives at the same
Hmm.
time or really close together, or really like even within the same week, that's an issue, and that's just calling for adverse reactions because basically it's like we're just giving them a cocktail of endotoxin.
Yeah.
So what we can have is basically the same response that if the cow would have a massive infection. So you see a very similar response to if you had like a coliform mastitis cow that it goes down and is like really
Hmm.
dehydrated, etc. So that's like the issue with with coliform bacteria or like gram-negative vaccines is that you have to really avoid that kind of like endotoxin stacking when planning your vaccination protocols and when everything can be given. It's like okay, you need to be careful with how many gram-negative vaccines you put together.
Right. Right. Awesome. Thank you for explaining that. So, going in that similar vein, a couple of producers that I know, they vaccinate for salmonella in their cow herd to potentially help the calves. When you're talking about salmonella Dublin, and is that the cell mediated one or no?
Yes. So
Yes.
yeah,
Okay.
that's a good point. So yes, I mean there are different vaccines in the market, but yeah, salmonella it's an intracellular pathogen, so
Okay.
likes to hang around inside like immune cells such as macrophages, etc. So yes, what we want to optimize is a cell-mediated immune response.
Okay.
That's really what we want. So that's again, unfortunately, that happens a lot with vaccines. There are not many head-to-head comparison of vaccine A versus vaccine
Hmm.
B. So it's really difficult to say, and I really have like no data, but like empirically,
Yeah.
a modified life vaccine based on their mode of action,
Hmm.
it's supposed to have a better cell-mediated immune response. However, it is also true that newer studies have been done with some of the subunit vaccines that have shown that those vaccines also mount a cell-mediated immune response. However, again, they are not really measuring like the magnitude of the response, and it's again not
Right.
really saying like, oh, it's not even say like, yes, this type of vaccines mount a cell-mediated immune response to the same level than this other one. So they're really comparable. They're just, again, they were just looking at it's the first step, but it's not really have
It's
no
not
data to
conclusive.
say
Yeah.
A is better than B,
Right.
but based on our understanding of how immunity works and which arm um, of the immune response would be preferred for like targeting a salmonella
Hmm.
infection, would be more comfortable with modified life.
Okay. Yeah. And I'm thinking specifically of Dublin, would heat treatment of that colostrum be beneficial in the sense of killing off Dublin specifically?
Uh, that's a good question. So I'll have to put like some like caveats. Like okay, first of all, I'm going to go one step back. So yeah, so like we traditionally thought that colostrum was one of like the ways in which like doubling
Hmm.
um, was transmitted based on like the study that I presented. But we basically enrolled almost 150 cows that were positive to doubling.
Right.
We collected colostrum from them. We did culture all those colostrums, and we found no doubling.
Interesting.
So that makes me, I mean, we found no doubling in either the feces or the colostrum or the cows, which makes me, again, that's my issue with doubling is that each time I do like a research project, I end up with like more questions than actually answers. But it just makes it
Okay.
because like it's like yes, we traditionally thought that was like the transmission path. I'm not sure that I have like evidence really showing. Oh yeah, again, we all those animals were tested before they were enrolled,
Hmm.
and we knew that they were positive to doubling, yet we were not able to culture. And actually answering your question, so yes, heat treatment of colostrum decreases bacterial contamination. Some of the bacteria that have been shown to be ineffective are Salmonella species. To my knowledge, I'm not sure that it is necessary that the study has been done with doubling specifically.
Okay.
Yes, it could help
Okay.
uh, decrease like bacterial load, and among those will be
Hmm.
like Salmonella. But
Yeah.
I'm not sure that that has been proven for doubling.
Hmm.
And as I mentioned, I'm still right now like trying to like explore more and get my hair around of like, is it really an important route of transmission
Right. Right.
for calves, since we were not able to find it in 100
Right.
plus samples of cows that were positive for doubling.
Yeah. Awesome. There haven't been any other questions that have come in. Thank you all so much. I know quite a few of you stuck around, and I appreciate the questions that were sent in. And thank you for your participation in this. And I hope everyone has a wonderful rest of their day. And thank you so much, Angel, for sharing your wisdom and all the work that you do.
Happy, and thank you for having me.
Absolutely. All right. See you around.
Yeah.